You can't talk about lip lifts without talking about the scar. I get so many comments that I really want this procedure, I love what it does, but I'm so scared of the scar. Well, you don't have to be scared of the scar if it's done properly. I really have not had experiences where the scar is a significant issue. In fact, majority of the time it's completely seamless and even hard to find. We achieve that by doing a lip lift the correct way, meaning we're not just excising skin and pulling it together, but we're lifting the skin and we're anchoring it in the deep plane in order to avoid that wide scarring. So even in cases where you can go up close and see the scar on someone, that is still not someone who you're going to see on the street, look at, even have a full conversation with, and know that they had a lip lift. I always ask my patients who's noticed, any family members, and the answer is always no. Nobody really notices that they had it because unless they come in and they show them their scar, they're just not going to see that scar. What they will see is a significant improvement in their overall aesthetics. So the comments that they typically get is, wow, you look nicer for some reason, I don't really know why. And that's another benefit of this procedure. When you get a lip lift, they'll notice the improvement, but they really won't know why. It's one of those that's not very noticeable where people take into account, oh, I remember your lip was only this long or that long, or you had more tooth show. So it's just one of those things that's very nice and subtle underneath here. Even when we do the corner lip lift, this is another one that people are scared. They're thinking, okay, this is hidden underneath here, but what about this incision? It's wide out in the open. Well, the corner part over here, the lip here, is very different, and we're able to disguise it right in that transition zone. We call it the vermilion border, and that is where it turns from that lip mucosa over to the skin. By creating a nice incision and again anchoring in the deep plane, it becomes very nice and seamless. So the scar is a concern for a lot of patients, but it really shouldn't be an issue because we can disguise these scars, and the benefit significantly outweighs any sort of scarring that you may see up close if you try to look for it.